RNIB is one of the leading sight loss charities in the UK, and we have the largest community of blind and partially sighted people. Part of our role is that we deliver direct services to help people with a sight condition to remain independent and continue to lead their lives as independently as possible. So RNIB Scotland and Optometry Scotland have worked together for many years on a variety of different projects, looking at the eye care pathway, how to support people who are blind and partially sighted, and more recently we've been working on the ECLO project as well. ECLO stands for Eye Care Liaison Officer, and an ECLO's role is to support people who have been diagnosed with a sight condition to remain independent and access services across health and social care. We know that health and social care services are often complex and people don't know where to go. Our ECLOs provide a listening ear, onward referral to local and national services. The ECLO project, working with Optometry Scotland, is an early intervention eye care pathway, developing a referral link from community optometry directly into RNIB ECLO services. We presented information at a variety of meetings for OS members, and from there we also designed an evaluation which Optometry Scotland very kindly sent out to their members. We were able to use that information to evaluate and design and implement the project going forward. There are so many members and professionals working in community optometry, so for Optometry Scotland to support us to be able to reach them in a one-stop place was hugely important for us. So for participating practices, we're going to be sending out referral guidelines, so the professionals working in the practices are aware when to trigger a referral into our services. We will then be providing some training, which our ECLOs will provide either to the practices, and we've also got some digital training that we'll provide, which will be understanding sight loss for all practice staff to be able to access. The impact of the ECLO project for both optometrists and patients is going to be significant, I believe. We know that patients, when they're attending community optometry, that's where they often get that diagnosis or an indication that something might not be quite right with their sight. The project allows patients to access support so much earlier in their eye care pathway journey, and that's crucial. For optometrists, we know from our work within the eye clinics that actually the ECLO services save clinical time. Optometrists are going to have a one-stop shop. They know when a patient is distressed or anxious who they can signpost and refer to. It's really important for Optometry Scotland and RNIB Scotland to work together. Both organisations bring a wealth of experience and knowledge, and that way we can deliver services which really support the needs of blind and partially sighted people and people living with a sight condition, their carers and their family members across Scotland. RNIB believes that this project is going to make a real impact for people living with sight loss in Scotland, and we're really excited to be working with Optometry Scotland to develop the project further in the future.